So congratulations to all the viewers on the auspicious Independence Day, celebrated as a national day on every 15th of August. And India will be launching an year-long celebration from August 2021 to commemorate 75 years of independence with a slew of programs and projects to showcase development, governance, technology, reform, progress, and policy over the years. So I'm Dr. Rakesh Gupta, President and Director of Public Health Strategic Institute for Public Health Education and Research. And I have with me Dr. Sonu Goyal. He is professor in Department of Community Medicine, and he's also Director of RCTC in PGH Chandigarh. So dear viewers, we welcome you all to this very special edition of Cypher Health News channel being released on our Independence Day. And we are delighted to have with us Padma Shri Dr. Mahesh Verma. He is Vice-Chancellor of Guru Gobind Singh, Indraprastha University, New Delhi. So you're welcome, sir.
Thank you, Dr. Gupta. Thank you.
So Padma Shri Dr. Mahesh Verma, he's a prosthodontist of international repute, and as I said, he is a Vice Chancellor of Guru Gobind Singh Indraprastha University, and he's also Professor Emeritus in MAIDS, and he is a former Director and Principal of Maulana Azad Institute of Dental Sciences in New Delhi. He graduated in dentistry and secured his master's degree in Prosthodontist (MDS) from the Government Medical College, Thiruvananthapuram. He joined the Institute of Dental Sciences of Maulana Azad Medical College and became the head of the institute in 1995. He also did advanced training in prosthodontics at the State University of New York, Buffalo, and earned an MBA from the Faculty of Management Studies, FMS, University of Delhi. He helped to develop MAIDS from a dental school of meager proportions into a center of excellence. A WHO fellow, he teaches healthcare management at the FMS, New Delhi.
Dr. Mahesh is also involved in WHO social and community projects, as well as several institutional projects of Council of Scientific and Industrial Research, which we known as CSIR, and also Indian Council of Medical Research. The Government of India awarded him in 2014 with Padma Shri, the fourth highest civilian award for his contribution to the field of medicine. He has diverse fellowship with his name. Some of them include FAMS Fellow of Academy of Medical Sciences, FDSRCS from England, FDSRCPSG from Glasgow, FDSRCS from Edinburgh. He is currently the president of International Association for Disability and Oral Health India Chapter, and also Indian Academy of Restorative Dentistry. He is also chairperson of Research Committee for Dental Sciences at Indian Council for Medical Research, ICMR, and Technical Committee of NABH, that is Quality Council of India. He is also honorary advisors for Armed Force Dental Services, Ministry of Defense, eminent research scholar and scientist, and Armed Force Medical Research Committee.
Dr. Verma, he has been bestowed with the various awards and honors. To name a few: Arogya Sevavriti Puraskar in June 18 at Mumbai, 28th TP Jhunjhunwala National Excellence Award by TP Jhunjhunwala Foundation in February 2018 at New Delhi, Elmer S. Best Memorial Award by Pierre Fauchard Academy USA in Annual World Dental Congress, Madrid, Spain 2017, Sushruta Award by Indian Dental Association Head Office in December 2017, Dentist of the 2017 Award, Dentist of the Year by American Academy of Implant Dentistry during the 66th annual meeting of the American Academy of Implant Dentistry at San Diego in October 2017, Global Oral Health Progress Award for rendering valuable service in furthering global oral health during FDI Annual World Dental Congress, Madrid, Spain in 2017 by IDM. Then Aryabhat International Award 2015 during third Healthcare Summit and Awards in May 2016 at Bangalore. Lifetime Achievement Award by Indian Association of Positive Psychology and Manav Rachna International University of Faridabad 2016.
Thank you, Dr. Mahesh, for being present here in this show. And first of all, I would like to welcome you to this important show which we normally host for a eminent leader and eminent personalities across the globe. So welcome, sir.
Thank you, Sonu. Thank you, Dr. Gupta. It's such a
Thank you.
pleasure to be with you. I understand your mission, your zeal to make a difference, especially tobacco cessation areas and other allied healthcare initiatives. And I'm very happy to be part of these endeavors. Thank you.
Thank you, sir.
Thank
Thank
you,
you.
Dr. Mahesh. So the first question, sir, we just want to ask you because I have seen your achievements and the things you have made a small dental college into a center of excellence, and many more initiatives you have done in Indraprastha University as a Vice-Chancellor where you are in. So just want to know a bit more about your early life, how you have been grown in, and what actually motivated you to do such endeavors.
I it's a very interesting story. Every time I narrate it, it's really you feel so elated, and it really pumps that adrenaline in you, that how you started. I started very humbly. I had my early education schooling in Himachal Pradesh. I used to live with my grandparents, and my father was with railways, and it was a government school, middle school, and there was no school beyond 8th. So the next school was far away, so I moved to Punjab, because my father was with railways, and so I had to pursue my higher education. So I moved to Bhatinda. I did my pre-medical from there, because if middle in Himachal, then in Punjab, and then after my pre-medical, I went to Trivandrum, to do dentistry, and I did my post-graduation from the same college, and so then I came to Delhi in 83 or so. In 84, I joined the dental wing. It was a very minuscule kind of a wing of a medical college, and we were a part of the medical college, and we were very primitive, very kind of very small time, like just like a department of a medical college. But we had started a dental course there, BDS, and to the extent that we did not have much of infrastructure, faculty, other requirements, that Dental Council of India in 1992 or 93, they de-recognized us. Can you imagine that only government dental college in the country, in the capital, behind the Dental Council of India, because Dental Council of India's building is just next door, and we were de-recognized because we didn't have enough in terms of what was really required. But God was very kind that I took over in 95. I was still an associate professor that time. We did not have much of faculty, and things moved up. And, that's how we, as a team, I must say, I must give credit to my entire team, because we were a small but a very well-meaning team, a team which believed in action and reaching the goal. And so I was assisted by my team, and we could, from the worst in the country, we were de-recognized to the best in the country. And I again don't want to brag about it, but ours is not only a center of excellence, it is ranked the best dental college of the country. It is in a state government, and it is also NIRF ranking, which is official ranking of the government. For the last 2-3 years, ever since they started doing it for dental institutions, we are ranked #1. And of course, there is independent assessment. So it's been, so it's a, I feel it's a privilege, it's an opportunity, and it was a teamwork. We all could do it. We could turn around, transform something. And not only that, it's a big history. It didn't happen overnight. It took a long time, and we got separated from the medical college into a independent department, like a separate dental college of the government. And then I further on, I converted into, made it into an autonomous body, like a, it has a governing body, like just like your PGI in AIMS is by the Act of Parliament. Here it is like any government independent autonomous body. So that converted in 2007. So it went through a lot of stages,
Right.
and so we are very happy that what we are today. Thank you.
So wonderful, sir. I think because it's really heartening to listen. We were not aware about that a college which was de-recognized at one point of time was converted into a best dental college, which has received a NIRF ranking for continuous many years.
And not only that, it is the only dental college which is NABH accredited.
Wonderful.
We got NABH accreditation in 2011, dental
Right.
college, and I think the last 10 years it is still there, and we have had many cycles of reassessments, and I think probably they may, I mean, there could be one or two more, but till some time back we were the only one. So
Okay.
that's again, we have a, in our Maulana Azad we have 7 institutions.
Right.
We call it a Sapt Rishi, like
Right.
Maulana Azad Medical College, we have a GB Panth, we have a Guru Nanak Eye Center, we have a dental institute, then we have a nursing college there, Ahilyabai Nursing College,
Right.
and then we have a Lok Nayak Hospital, and then we
Right.
also have a trauma center, Sushruta Trauma Center. So there are 7 institutions, group
Right.
of institutions. So so it feels nice that you were able to create a kind of an island of excellence in the midst of all this. Yeah, thank you.
So your journey actually from this de-recognition to NIRF ranking, NABH accreditation, best dental college in the country, so teaches us a few lessons in on leadership actually, which we all need to learn about, like how to take challenges with courage and how to convert a challenge into an opportunity. So I think this is one thing which you have really demonstrated, and how your teamwork can play a role in doing lot many things. And again, it also talks about the change management, which we normally teaches to the students, but now you have amply demonstrated it. So thank you, sir. So Dr. Rakesh.
So, Dr. Verma sir, will like to know about your eminent work as a prosthodontist, and what should be the role of dental surgeons in tobacco cessation? As you know, we are into tobacco control very actively.
Yes.
So we'd like to know about the tobacco cessation
No,
initiative.
I feel that my endeavor has been to create, to nurture, to support the profession. Because your specialty will only sustain if your profession sustains, isn't it? If our profession, dentistry, is doing well, obviously all the other specialties will be doing well. So basically, my focus, like as I told you, that I come from a very humble background. I had no a kind of no guidance or anything, and it's always on the job training. Like there is no cookbook recipe, isn't it? Nobody tells you to do this and then you achieve that. So I always believed in that we have to enhance, elevate the level of education, patient care, research, innovate, setting new standards, always desired. That was my desire. I always had a great desire and ambition to study abroad, go abroad and learn and see what they're doing, how they're doing, what different we are. And, 4 decades back when we were students, we didn't even have access to books, what to say of materials and technologies and all those things. So that fetish, always was there in my mind. So I always, wanted to move from basics to innovative, the best, the better, how we can elevate it. That was my desire, and probably that really helped me. And I used every opportunity, to turn it around. Being in Delhi, and that too in Maulana Azad, I think that was a big privilege, because I could, I could do a lot of activities and learn from others. It's always you learn from others, and that's how you grow, isn't it? I use every opportunity to go abroad, learn what is new there, what we can do here, I always wanted, every year I used to go a couple of years abroad, learn, attend conferences, fairs, shows, and bring the technology here, learn and what can be adapted here. So that was it. And then simultaneously, when you do that, as I told you that I was in Delhi, so I could hold a lot of activities. Anybody who came to Delhi, I would invite them to Maulana Azad, arrange a lecture, conferences, meetings, shows. I hosted Commonwealth Dental Association conferences where we had participation from more than 100 countries. Then I hosted world's biggest dental conferences twice, which is called World Dental FDI, Federation Dentaire Internationale, FDI World Dental Congresses here in Delhi in 2004 in Pragati Maidan. Then in 2014 again, we had about 26,000 delegates from almost 150 countries. There were no hotels, in Delhi and Noida and Greater Noida. So all those things, I think it was a lot of opportunity also, because, it's also, you got to be a little bit lucky also that at the right time you get the right opportunity. So we could learn and we could assimilate and move forward. And simultaneously, when that happens, your specialty also grows. And I always wanted technology incorporation, and in my specialty, like I come from an era when the education was very primitive, especially in like a fixed prosthodontics, we call it crown or beige. We were doing a very simple and a very basic and a very primitive style of fabrication those days, and from that converted to CAD CAM, computer aided design, computer manufacturing. I was the first dental college in the country to acquire that technology in the dental college. And not only that, we always used private sector also. I was the one who brought in, started implants fellowship here by American Academy. It was, our college was one of the centers. Objective was, let students learn, let faculty learn, and they not only train the trainers, but youngsters, we can catch them young and they can spread the knowledge. So that has always been. And not only that, in other areas of prosthodontics, like complete dentures, how technology we can do, maxillofacial prosthesis, removable prosthodontics, and all those some of the new areas like TMJ, temporomandible joint disorders, all those things brought in some new technology. I always wanted to innovate and try and experiment, because unless you experiment, you cannot,
Right.
you can fail, but unless you try, nothing happens. So that has been my endeavor. And then, as Dr. Gupta said about tobacco cessation, see, we know that tobacco cessation has a huge role today. We know that tobacco is something. It's like it's a very it's a very pernicious habit. It's something which, of course, I'm very happy that all these efforts, which like you and your organization and your other ilk of organizations are doing, it has really brought down the smoking. We don't see very many people now smoking, at least in big metros, openly, publicly, because all this has been a continuous effort. So I think for dentistry, I was little little proactive and foresighted that in 2020, in 2001, we established the first tobacco cessation clinic in a very primitive in the dental college. I arranged some 1 or 2 chairs, and all those patients who were coming, they were identified, they were taken, their history taken, counseled, they were tried different counseling, therapies, drugs, and then this went on. And today, as you know, that Maulana Azad has been selected as the National Resource Center for Oral Health and Tobacco Cessation by Ministry of Health and Government of India. So it's a big move. And I feel that dental colleagues, they have a big role, in tobacco cessation, because, see, what is our objective? We want to promote oral health. And
Right.
oral health is a very integral part of a body health. You know, I always say, you may be healthy, you may be, but unless your oral health is fine, that feeling of wellness will never come. You will never feel that the tree, when you go to a spa, what does it give you? It gives you a feeling of wellness. That unless your mouth is healthy, you will not have, your body may be healthy. And I will not call a body healthy if your mouth is not healthy, because one compartment of your room where you live is filthy. Can you consider the remaining part of the room healthy? No, it cannot be. It has to be, and it's a gateway to the body. So our objective is uh, promotion of oral health, and oral health is an integral part of general health. So we have to do away all these ills, like tobacco cessation is one of the biggest factors in bringing death. So dentistry, dentists, dental professional, they're very privileged lot, because tobacco is one of the causative factor for many of the dental diseases, and they're the ones who are in close contact. So not only they can counsel, mentor, monitor, examine, identify, they can really play a big role. And I'm very happy that our medical colleagues have realized that, because earlier, they said, what is the role of a dentist in a tobacco cessation? They used to think like that. But today, they know that they have we work with a patient, we come in close contact, and so we have so much of a time to make a difference, counsel them, tell them, motivate them. And not only that, tobacco is a big contributor to a poor oral health. And so we can identify the early effects, motivate them, turn it around. So I don't say that only dental surgeon can do it, but I think dental surgeons also has a huge role to do it. And I think now the Dental Council of India has directed that all dental colleges should have tobacco cessation clinic. There's a lot of emphasis on a public health, motivation, counseling, and it's also, see, one of the huge areas, because if you look at it, it can really bring down the huge burden of oral diseases, because the tobacco can contribute very substantially, to not only to the oral health, to the general health. So we are killing two birds with one stone. We're doing it. We're not only taking care of oral health, but we are also, somewhere making a difference in the general health.
So I and Dr. Sonu, we have visited MAIDS, and I must confess that the stamp of your leadership is there, and the sense of ownership you have. It's really marvelous, sir. And I must confess that it is one of the best hospitals. I have seen many corporate hospitals. It is much better than many corporate hospitals with so many specializations in dentistry, and even the community dentistry is doing very well. And we have also seen the tobacco cessation center. I think it is also excellent. And
And
um,
yes, we have a very
and you are providing you are the role model for many dentists all over the world, I must say.
I feel that I say that it's a teamwork, and we are very happy that today Maulana Azad Institute of Dental Science is like a showcase it's a representative of the profession in the country.
Right.
I've had many examples that earlier, when we were in a very primitive form, people used to come and make fun of us, and the very same people come back now, look at the institute, and they say, wow, what an institution. Rakesh, I'm sure that after your last visit, I'm going to share with you that we built one more 12-story building. So
Yeah, that time it was under construction,
building,
sir. Yeah, I've seen that.
21-story building,
Yeah,
which is a built-up area of about 2.5 lakh square feet,
right.
only dentistry. The medical subjects are taught in the medical college, and I don't think, I have been all over all the 6 continents, and I haven't seen a college like this. And I'm very proud that our team was able to establish such an institute right in the capital of the country. And it showcases what dentistry is today. And I have seen literally how the people's perception, people's approach, people's attitude to dentistry, and all of us dental professionals have changed over the years, because when they have seen it happen right in front of their eyes, they really feel that yes, so that's how, and I think it's a well earned respect and well earned position, and that's why they just cannot belittle us now
Yeah.
and undermine us, and
Mm.
they in fact come forward to collaborate and to join together, and they also say that okay, we can do things together. That kind of attitude was missing 20 years back, and we're
Yeah.
very happy now. Everybody, government, state government, central government, my medical colleagues, other bodies. I also part of the medical council. I'm a member of the medical council, so I also feel proud that as being a dentist, I'm representing my profession in the medical council also. And then we in the dental council, we are medical professionals. So it's a well integrated profession is getting well integrated, and as we always say, oral health is a very important part of our general health, and we have to integrate the both, and that's how we can move forward and
It's
achieve.
involving all the medical colleges for this tobacco cessation. It's a big achievement, I must say. And the dental surgeons, they are the first point of contact for
Absolutely.
these tobacco users, basically the people who use chewable tobacco. So it is excellent, sir. So, Dr. Sonu, yeah.
Yes. So, sir, I think it's a wonderful journey of yours. I really mesmerized listening to your story. So, because we also teaches International Public Health Management Development Program for last 5 or 6 years, which is sponsored by the Ministry of External Affairs, Government of India, and we have trained around 700 odd people from 100 countries. So, I think that they will be delighted listening to this particular talk, because we used to tell them leadership lectures, and your talk itself is a leadership where we talks about mission and vision from your journey. I think we can see you have a great mission, and you are able to achieve that mission which you have thought about. You have a good foresight at the beginning. Like in 2001, you opened the Cessation clinic where nobody knows about like what to do on cessation, bear apart the dentistry. I think this is another wonderful thing. You are not afraid of doing innovations and experiments. You have tried all level opportunities to learn from others and implement that in your settings. You use the technology at the right point, which the leaders do, and you demonstrated each and every example of taking opportunity and and using that for the overall welfare of the public. So I think this is all the very true examples of the leadership. So just want to listen from you any short case story of leadership, like anything which you remember from your past about anything which you have done, which has actually, besides the story which you have already told, so which you have done on anything on leadership, or anything which actually motivated others to replicate or to implement what you have been doing in your
I
career.
think, there may be so many stories, but I think my story, which is very well evident and which is a case study also it's a case story in the management schools, is, turning around dental wing of Maulana Azad Medical College into a medical institute. I think this is a kind of, it's a kind of a unique story. And again,
Right.
as I said, that you don't structure it or create it. It happens. When you work, see it. You don't create. You don't chase the success. As I always tell my youngsters, don't chase the success. Success will be a byproduct. You keep on doing and you leave your trail. So there may be 100 other examples of leadership, but I think this has been, which is evident, and I want to share with you why I call it a story. Is that after I did that, so many of my medical colleagues from the medical college came up to me, and they came and they told me, "Sir, कुछ हमें भी मंत्र बताओ, कुछ हमें भी कुछ कुछ नुस्खा दो कि ये कैसे हो सकता है. And I want to share with you that a lot of my colleagues who wanted to set up neonatology center and other such specialty centers, they came up to me that how do we start, how do we make a project, how do we do it, you know. So that's again again uh, a kind of a feeling that yes, of course, as I said, there's no cookbook recipe,
Right, sir.
you know,
Right.
because every situation is different, every domain is different, your environment is different, you know, you have different kind of settings, and it cannot be replicated that it happened here and can be replicated, you know, because it's a different scenario, it's a unique situation, everything. But you know, in terms of a leadership, I you know, like as I did my you know, I when I was building this college in way back in 2001, you know, this project was the foundation stone was laid in 2000 of the new building. In 2001, I joined MBA, you know, here in FMS, Faculty of Management Studies. And 2003, I passed out. So in 3 years, I had 22 exams to pass, thesis to write, and I was doing dental college also, all this new project also. But I think somewhere that also helped me, you know, the visibility, you know, that if you are carrying an MBA degree, people treat you differently. Although there are no something which you you learn and you apply. It's always on the job training.
Right.
And then I started teaching there. And whenever I was teaching there, I used to teach strategic management, which is a very important subject in the last semester. And I used to bring my students, almost 6 or 7 batches I taught them. They were all doctors. I would give, last time, the last class would be held in Maulana Dental College, and I would host a lunch for them. And I show them around, you know, like this thing that see how I started and how I, you know, a little bit of a leadership example and motivate them. And that if you're determined, you can certainly do it. Of course, there'll be a lot of roadblocks and a lot of challenges on your way. But, you know, if you are determined, and, you know, I want to tell you, it has not been easy. My team knows that hundreds and thousands of challenges that we had, and we had no power, no money, no influence, no, but only our work, our credibility, you know, what we could show to the world, you know. You see, so that was only a kind of a baggage we had, nothing else we have to show to the world. And that's how we were able to do it. So the moral of the story is that, you know, keep going, and things do not happen overnight. And I always tell my students, you know, now that everybody is in a hurry, they want things to happen overnight. It took many years, many decades. So you got to be persistent. You got to be keep trying. You know, that old age, you know, the old age the story that slow and steady win the race. So you keep on trying it. Of course, you get frustrated. Sometimes you feel like surrendering. You feel like running away. But and I think that failure itself is a great opportunity to learn many things. So you got to be persistent, and I'm sure you know, each one of us can make a difference. Certainly.
So wonderful, sir. I think I would love to invite you in our international program in case you have time to interact with our colleagues from like 100 plus countries who usually come twice a year. Right now we are having this program online, but they come physically here. And we used to meet many leaders. We used to invite them for their talk. So we'll definitely like to use this opportunity to listen about your talk as well whenever you have time.
You know, sometime when you have, I would like, you know, I would like to probably maybe deliver a lecture or something.
Yes,
if you give me a topic, I would love to interact with them.
Really,
and also, you know, we are running some program with some of the healthcare organization here in Delhi. We are running certificate program. We are running a diploma program. And if anything we can do together, you know, especially in this area, health management, tobacco cessation, whatever, we want to do some certificate. Of course, PGI itself is a university, and you know, you are you don't need any approval from
No, but
any.
definitely, sir, we'll like to have like collaborate
But
with
it's
you.
something we can
Uh,
do.
in which,
I mean, I'm quite open to it, and I would welcome, because any, as I said, that we always need to innovate,
yeah,
always to try to learn what has not been done.
exactly,
That's
exactly.
how you are able to do something. You of course fail many times. It doesn't work, but it's okay. Nothing happens without trying. At least try. Let
And
us
that's
try
the
and
another
fail.
lesson. That's the another lesson for our young colleagues actually, that people usually afraid of being failed. So I think
Yeah.
failure is one of the lesson
That's
by
okay.
which we should motivate ourselves to keep further going. So that's the one which you have amply demonstrated, sir. Dr. Rakesh?
Yes, sir. Your story is really very motivating. And sir, I'd like to ask about your.
Yes, my family, yeah, wow, wow. I have a very small little family. I have one daughter, and we are a dental family, and a very passionate dental family, because my wife is a dental practitioner. She is a senior dental practitioner, having her own center, own practice here in Delhi for the last, I think, about 35 years. And my daughter is a dentist. She's a prosthodontist like her father, and she's an assistant professor in Southern Illinois University, here in US. And my son-in-law is an oral surgeon, and he's an oral medicine also. He's done two specialization, and he's also director of oral and maxillofacial surgery at A.T. Still University in St. Louis, US. So they live in St. Louis, and my daughter drives about 30-40 minutes to her school. So they both work in independent dental schools. And I have a small little grandson, which is going to be 1 year in September. And we've been trying to fly to US, but as you know, that the visitors are not allowed as yet. So we're just waiting so that we can go and join them at his first birthday. So, and my brothers, I'm the eldest in the family. I have two younger brothers. My younger brother is into pharmaceutical. They have a pharmaceutical company. So, and my youngest brother is a veterinary gynecologist. He just retired from Punjab Agriculture University Veterinary. There is a Guru Angad Dev University of Veterinary Sciences in Ludhiana. So he was a director extension there for 4 years. He just retired. And I have my one sister who lives here in Delhi, close by. She's a PGT, postgraduate teacher in English. So that's it. I lost my mother at a very young age when I was in class 11. And I lost my father about 15 years back. So, that was it. And as you know that, all of us belong to a very middle class, lower middle class families. And it's only, the God's blessings. And, as we are all being brought in such an environment where your parents try to push us hard, that you study and you excel, and that's how you go forward, because we have nothing else to bank on, unless you study, you go ahead. That's how you succeed in your life. Thank you.
Right.
It is yeah, great to learn about your family. And in fact, when I visited your center, I met your ma'am also.
Life, yeah.
And it's nice to learn that daughter, son-in-law, they're doing very well. So
Right.
wish my best to them.
Thank you, sir. Thank you.
So Laksonu?
Yeah, sir, I think lot many lessons on leadership we have learned, and at the last you have said that you belong to a middle class family, and being in a middle class family, you have reached to such a heights. I think it's again inspirational to many people who think that like when you are in a lower or middle class family, you may not be able to reach those heights. But I personally feel, being from a lower middle class family, that when you are in a lower middle class family, you have more challenges, and when you overcome those challenges, you are able to reach more heights than when you don't have much challenges. So, sir, last lessons, what further lessons, although you have told many lessons to like public health professional and budding professional in any areas. So any last minute lessons which you like to give?
As I said, that what happens that today's youngsters, they have a different mindset. And not everybody, I say predominantly, grossly a large number of them, For them, success is making money, or somehow by hook or crook they want to succeed in financial gains, or in terms of name, or fame, or something. They want to, they always see that, oh, look there, he's reached so fair, why cannot? Yeah, I think that's a great drive. But please remember that things do not happen overnight. You got to be consistent, and you got to be, you got to be very realistic. You got to be very true to yourself. You got to be passionate. And as I always say, that don't chase awards and chase success. The success will be a byproduct. When you do, you will get awards, because that's something which will chase you. So rather than doing it otherwise. And I think, again, see, each one of us can contribute in some way, some manner, and stand out. We got to be very passionate about learning, sharing, collaborating. Please remember that you cannot grow all alone. You need somebody to collaborate. If you want your efforts to be magnified, you need somebody else. एक into एक जो है वो 11 होते हैं. एक प्लस, अगर आप एक into एक करें तो 11 होते हैं. अदरवाइज तो अगर अकेले ही रह जाओगे आप, है ना. तो आजकल के टाइम में इट्स ऑलवेज टीम वर्क, कोलैबोरेट, work together. Like, I give an example to your team now. You have Sonu, you have Dr. Gupta, you have another gentleman in the background. So I'm sure you have so many team, and that's how you move forward. So this lesson, sometime, that philosophy is gone. Akla chalo re. That philosophy is gone now. The philosophy today is Sathi Hath Badhana. Come, please, extend your hand and let's move forward. So that's it. And the second thing is that, you got to stand out in a crowd. See, we are a crowd here. So you got to be different. Don't imitate what others are doing. You be different. You got to stand out. It's, what happens that somebody is doing and you also doing the same thing. I mean, I think there's no point. If you really want to, you got to be different, stand out in a crowd, create your own path, own niche, and leave a trail, isn't it? I mean, जैसे हम सिंगर हैं, अब देखा होगा जो नए सिंगर आते हैं, they just copy Mohammed Rafi, they would be another Mohammed Rafi copycat. They will not be able to be a different singer. So you got to be, different. That's what. So some of these things, and fortunately, I must say, Dr. Goel, that youngsters are very smart these days. They're much more wiser. They have better attributes than what we had as a children, as a student. We had nobody, no guidance. We were not guided. Today they have so much to learn from the media, from social media, from their peers, from their parents. There's so many people to guide them, and they themselves are so much smarter. Look at the youngsters today, and compare it with the youngsters 20 years back, 30 years back. They are more confident. They are more communication skills are very good. Social skills are very good. They know the entire world. Even when I was in a village, can you imagine when I was in a village, most of my class had never seen train. Many of them have not seen even a bus. Can you imagine? You imagine that for them is going to jungle, bring lakdi. We started studying English in ABCD. Today a child is born and he speaks in English. It's not that English is knowing English makes you something great, but it makes things very easy for you in your academics, because all our academic, your expression, your writing skills, your thought process, all those becomes much more. So, I feel that, but that's a good thing about the youngsters. So they need little cue, and they can really turn out to be a super duper, successful. So, yes.
Great, sir. I think it was wonderful listening from you, and this talk itself becomes a case story in which you have taught us many lessons. And I think I'm really mesmerized, as I told you, listening the entire story right from your childhood to your professional days, and now you are working as a vice chancellor and you are leading a team, and all those teams which you are leading have also become a leader. I always say that the definition of leader, which is like who has followers. So now the definition of leader, I say that the leader who create more leaders is actually a leader,
Right.
and which you have amply demonstrated. So thank you, sir. Thank you for being with us. So thank you for being with us, Dr. Rakesh.
Thanks, sir, for being with us. And I'm sure our young public health specialists, clinicians, dental surgeons, they will all benefit from this talk. And we'll be sharing with the participants of the International Public Health Management Development Program and with our colleagues also, with our friends.
Thank you so much.
So thanks a lot, sir, for being with us. Thank you.
Pleasure.
Thank you, sir.
Hello and welcome to the Health Minute Highlights. Door-to-door COVID-19 vaccinations began in Mumbai on July 30th. A BMC affidavit was presented to the High Court, according to which no adverse reaction was reported after vaccination. The High Court has urged all other district councils and municipal corporations around the state to follow the BMC's lead and implement the door-to-door vaccination program for bedridden people. The US FDA has approved intravenous infusion of avalglucosidase alpha-NGPT for the treatment of late-onset Pompe disease in patients aged 1 year and above. The intravenous enzyme replacement therapy helps to reduce glycogen accumulation in affected individuals. Researchers from Cambridge University are testing an artificial intelligence system for diagnosing dementia after a single brain scan. The scan may also be useful in predicting whether the condition remains stable for many years, slowly deteriorates, or needs immediate treatment.